it's Beck here from Sunbury Local Businesses, and I'm here with Dr. Latika Cilly here at Vineyard Medical Centre. How are you?
I'm good, Beck. How are you?
I'm really well, thank you. Now, I wanted to ask you, what is your profession? What do you do here at Vineyard Medical Centre?
So, I am an obstetrician gynaecologist. I have been working at Vineyard for the last 2 years. What we do is basically deal with all women's health issues. So basically related to obstetrics, like childbirth and pregnancy, most of which is high risk. But we also do other gynae problems.
Okay.
What we specialize in is like menstrual problems, fertility issues, people with pelvic pain, hormonal disorders, menopause, and prolapse.
Okay.
We do this quite often. So we also offer minimally invasive surgeries like keyhole surgeries, which can be for people who are wanting to have gynaecological procedures. I myself specialize in dealing with abnormal menstrual bleeding or abnormal heavy PV bleeding, which can happen in many of the age group between say 30 years to 50 years. We also have facilities to deal with bleeding after menopause, which can sometimes be quite scary because it can be related to things like cancer, but we can deal with all of those situations here.
Fabulous.
The most important part of our thing that we do here at Vineyard is we offer a family planning clinic as well. So we are able to do family planning procedures like the Mirena insertions here at Vineyard. We also run a medical termination of pregnancy clinic here at Vineyard, which is for the community. In terms of our procedures that we can do here at Vineyard, one of the major things is colposcopies. Colposcopy is basically a procedure which is recommended to any patient who would have had an abnormal PAP test. And we do our PAP tests quite regularly anyways, all of our women. But if there is an abnormality, which can be sometimes a very scary and daunting episode, but we are here to help. And once we have done their colposcopies, we can actually plan their treatment if need be for the future.
Okay.
So that's actually an important part of what we do here at Vineyard.
And so then, Latika, if someone were to make an appointment to come and see you, what would they expect in their appointment?
So, Beck, the most important thing that we need to realize here is that every person is individual in themselves. So, your problems are different from any other person's. And we need to tailor your treatment to you, okay? Not one size fits all. And that is exactly what they can expect when they're coming in for their first appointment. So on their day of your appointment, they can discuss their problems with me. Then we actually do a targeted examination based on what they have told me. Sometimes we do actually have to organize a few more investigations, in which case we follow them up in a week or two. And from there on, we will plan their treatment, discuss their results. In the same setting, we will also make sure that all of this has been communicated back to their GP so that they're not forever chasing the outcome of their appointments. We also have the facility to provide them with their Medicare rebate immediately on the day.
Okay.
So I feel that's quite helpful to our patients.
Absolutely. And so then, if people are wanting to get in touch with yourself to make an appointment here at Vineyard Medical Centre, how do they go about getting in contact?
That's very simple, Beck. All they have to do is call the Vineyard Medical Centre on 9216-5600. We are here every Monday from 8:30 a.m. but the clinic is open throughout the week and even on weekends. And they just have to ask for to be booked with myself. All they will need is a referral from their GP. That's it.
Perfect. Well, thank you so much, Dr. Latika. I really appreciate your time.
Thank you. Thank you for talking to me.